that he'd be ending his stay-at-home order. That was Executive Order 2063, and that was effective at the end of the day on June 9th. And then he, of course, moved into this safely reopening phase of Minnesota's economy and issued this new Executive Order 2074, which states that businesses whose workers qualified for critical sector exemption in Executive Order 2048 can continue to operate in the same manner as provided in that particular executive order. So the good news is real estate transactions continue to remain on the governor's list of critical sector work. Of course, this is limited to facilitating and financing real estate transactions, of course, including appraisers and title services. But as you all know, most businesses are slowly reopening as long as they're having these preparedness plans. I do want to point out that the same restrictions apply. So you have to stay at home if you cannot. You can only go out if you cannot do your telework or virtual residence. It can only perform that work outside of your home. And then you also have to follow all of the guidelines to the maximum extent possible. And that's what we're going to talk about today, and hopefully get a lot of these questions answered for you throughout the presentation. And as Lori indicated, feel free to write those questions in the chat, and we'll be, Ann, my colleague Ann, will be watching that closely. So as with any law, I'm going to preface all of this by saying, as with any law, it's really important to understand sort of the intent and purpose of the law. It's going to help you answer a lot of the questions. So I think the primary purpose of this preparedness plan is to think about all of the details in operating your business. And then for you in real estate, you're unique in that you are going to be public facing. So you're going to have some additional protocols and plans in place when dealing with the public. So again, from the standpoint of what's required of you, as I mentioned, there's a lot of parameters here that go into it, starting with the Executive Order 2074. So primarily, your preparedness plan has to follow what's the minimum in 2074, right? And that starts with any worker who can work from home has to continue to do so. I'm going to start off by saying all critical businesses that are in operation during the peacetime emergency are required to implement a COVID-19 preparedness plan. So some of the questions we've already received include things such as, hey, I'm a single broker, I don't have any sales associates under my brokerage, do I have to have a preparedness plan? Or how about you're not the broker, you're just a sales associate, you have your own corporation, you might have employees under that corporation, should I be developing my own preparedness plan? Again, these are unprecedented times. This is very new and unique. There is nothing in the executive order or any of the guidelines that say that there's any particular exemption. So if you are in operation and you have a business in operation, you are going to be required to implement a COVID-19 preparedness plan, and that is effective today. Again, as I mentioned, if you are a customer-facing business, there are going to be some additional guidelines that you're going to have to think about. And again, we'll try to go over some summaries here. But I also want to let you know, too, that all of this information is going to be a lot. So I would refer you to our association website. We do have a link right at the top for all COVID-19 related issues. And you'll see there's a big button that talks about the preparedness plan. And then we link to all of the documents that I'll be talking about or referring to, which lists, which will help you in creating your preparedness plan. So again, it becomes effective today. So as of today, you will need to have one in place. It has to comply with Executive Order 74. It has to comply with any industry guidance that's been provided. For you, it's going to be general office business and any additional applicable industry guidance. I think the important note here is that under the governor's executive order, there was a provision that indicated that state agencies that handle licensing of businesses or licensees were required to consider adopting additional applicable specific guidance for those licensees. I want you to all know that we did inquire with the Department of Commerce on several occasions, and it is our understanding that the Department of Commerce will not be releasing any particular guidelines specifically for real estate licensees. So, in other words, we are stuck with sort of the general business guidance that's been distributed. The other thing I want to have you keep in mind as we go through all of this, something we've been talking about since the beginning of this, and this is a decision-making standard, I think is always helpful as we are enduring all of these things. But how can I provide first-class service and move the transaction forward while demonstrating care for the well-being of others and reducing that risk of exposure to and spread of COVID-19 while you are complying with all of the federal, state, and local laws that have been put out related to COVID-19. I know it's not a small task, but I think this is a great summary that was put out by the NAR's legal counsel, and I think it's good advice to follow as you think about what you're going to be putting in your preparedness plan and how you're going to be describing all of the issues you're going to implement. Okay, so what's in your preparedness plan? Let's start from Executive Order 74 specifically. Executive Order 74 requires that the plan content has to include, at a minimum, these items. You have to have, you have to ensure that all workers who can work from home continue to work from home. You also have to ensure that you have to establish policies and procedures, including health screenings that prevent sick workers from entering the workplace. And we'll talk about some tools for that. You have to have some protocols in your policy about social distancing and your procedures and implementing that. You're going to have to put in your preparedness plan how you're going to establish hygiene and source control policies for workers. So in other words, are we going to have face mask coverings? Are we going to have hand sanitizer, those kinds of things? You're also going to have to establish cleaning, disinfection, and ventilation protocols for areas within your workplace. So that's kind of the minimum. And this, as you can see here, this is the MNR preparedness plan. As I talked about, we have put out, we posted on there a template that's put out by the Department of Economic Development. So that's what we're going to talk about next, because your preparedness plan, in addition to those items, has to comply with all of the industry guidance issued by the Minnesota Department of Health, the CDC, DEED's preparedness plan, Department of Labor and Industry if that applies, and OSHA if that applies to you. So as I mentioned, we're going to be dealing with just essentially mainly DEED's general business preparedness plan is what you're going to have to look for when you're developing that. So in your preparedness plan, you're going to have to describe how your business is going to implement all of these things at a minimum. I think sort of the basics here to remember, for those of you who are employers, under OSHA, you have a fundamental obligation to protect your employees from known hazards. And both the employers and the employees are obligated to follow any requirements under the OSHA, the Occupational Safety and Health Act. That act generally does not apply to independent contractors, but if you have employees, or if you even sales associates who have their own company and have employees, OSHA is obviously going to be applicable. And the other caveat here, I don't know if we have any builders online right now, but obviously OSHA does apply to construction and trade industry, even if they are independent contractors. Now, under the OSHA standards, you're going to have to ensure that you're assessing any potential exposures for employees, and you're going to have to develop some safe practices to minimize any exposure for your employees. And another important note here, so I just talked about the OSHA side of things, but another question that's already come up is, what's the difference? What if I don't have employees? What if all I have is independent contractors? And the answer to that is your Executive Order 74, as well as the DEED's General Business Preparedness Plan guidance, applies to workers. There's a distinction between our terms here. Workers, obviously, is not necessarily an employee, and it is our understanding that the governor's intent is that all of the obligations under Executive Order 74 and all of the guidance that has been released for businesses are going to apply to any worker. That includes independent contractors, that includes temporary services, et cetera, et cetera. So I don't want anyone to think that this isn't going to apply to them, because this is very broadly written. Important piece here is to, as far as what needs to be in your preparedness plan from DEED's General Business Preparedness Plans, I'm going to go over sort of the broader provisions that are in that, and we'll talk about some of the things underlying that. So first and foremost, we have to have infection prevention in our preparedness plan. So how are you going to address health screening of workers and visitors? I would encourage you to look at the Minnesota Department of Health's health screening checklist, as you can see here in the presentation. You can go on to the Minnesota Department of Health's website and obtain this. You're going to have to decide how you're going to determine before visitors and employees come into your office, or you are going to be meeting with employees, etc. You need to think about how you're going to identify this health screening checklist, or how you're going to implement that. I can tell you at our association, ours is going to be online, so there's an online form for them to answer these questions. So you're going to have to think about that. How far you want to go with that. Is that a screening checklist? Is that taking their temperature at the door? How far are you going to take that? You also have to understand how you're going to communicate, allow your workers to communicate to you if they are sick and experience symptoms. What your policies are going to be related to that, and make sure that they're staying home. How are they going to report it to you? And what your policies are going to be about meeting with clients and customers if they have any signs or symptoms. You're also obligated under the preparedness plan to inquire of your workers what concerns they may have and how you're going to address them in the preparedness plan. So another important thing to remember or think about is how you're going to accommodate vulnerable populations. As I'll talk about in a little bit, the governor did put out a separate executive order specifically to ensure that we are protecting our vulnerable populations. So it's something you're going to need to think about for both your employees and your clients. So you also have to implement social distancing provisions. Social distancing including is 6 feet of social distancing between all workers, customers, clients, patrons, guests, and visitors. So how are you going to implement that within your business? Another important or another good idea would be to post some signage within your business to remind people that we have to keep 6 feet of space between people. Obviously, the best recommendation always is to meet virtually if at all possible. If you are going to be meeting in a conference room, you're going to have to create space between them. Another suggestion has been to take out extra chairs so that people can't congregate in those conference room spaces, so you're only allowing a maximum number of people in there. But those are some things that you can think about independently within the context of your business. So what engineering and administrative controls will you be implementing? Is that going to be teleworking? Is it going to be staggered shifts of who can and cannot come into the office at any given time? What are your occupancy requirements? How many people can be in there? Also think about the flow and interaction of your workplace. And you're going to have some kind of signage or instruction on whether they can be all in the lunchroom at the same time, or how they're going to be moving around the office so we don't have two-way movement, things of that nature you'll need to think about and impose some signage so that people are aware of it. You might need to make some physical workspace changes so that we don't have open offices, whether that's putting in barriers or just moving them further apart. Again, addressing whether you'll be providing any protective equipment as well. So will you be requiring mask coverings to walk into your building? Will you be requiring hand sanitizer, as you know, washing your hands, hand washing facilities? Those are the things you're going to need to think about as far as what they do before they come in and what they're doing after they're going to leave. Worker hygiene is another component of the preparedness plan. All workers are required to wash and sanitize their hands prior to or immediately upon entry of the facility. So you're going to have, as I already mentioned, you're going to have something there, whether that's hand sanitizer at the door or some hand washing stations, or again, controlling how many people can be in a bathroom at the same time. You're going to have to describe how you will address requirements on source control, so in your preparedness plan. So where are you going to get that sanitizer? Where are you going to get that soap? What about face coverings? Is there anything else you're going to have in order to open your office to the general public? You're going to need to describe how you're going to instruct workers, clients, customers, etc., to cover their mouth and nose with their sleeve or a tissue when coughing or sneezing. I think probably the best way to do this is to make sure you have signage around your facility. Again, Department of Health has provided numerous materials that you can utilize to meet some of these goals. You also will have to instruct them to avoid touching their face and disposing of tissues in provided trash receptacles, and wash and sanitize their hands immediately after. Some of the things you need to think about as far as sourcing, they're also suggesting that you obtain touchless garbage receptacles so that people don't have to, you know, obviously touch the garbage can. Also, in bathroom facilities, they're talking about requiring if you have having a touch-free door into the restroom facilities, and if you don't have that, making sure that you have a trash receptacle very close to the door so that people can utilize a towel or a towel to paper towel to open that door and discard it immediately. So another component that you're going to have to think about in your preparedness plan that is required in the general deed preparedness plan is your workplace building and ventilation. So how are you going to be addressing building and ventilation protocols? You're going to have to think about finding ways to get the maximum amount of fresh air into the building and limiting air recirculation into the building. You have to keep all of your ventilation systems properly maintained as well. So what they're looking for in that preparedness plan is your protocols on how you intend to do all of that. Another key component is cleaning and disinfection. Describe your business schedule in your preparedness plan on what you're going to do to clean and disinfect every day. That includes routine cleaning and disinfecting, and of course, we're going to be looking at work surfaces, equipment, if you have vehicles that you're going to be sharing, if that's going to be part of your policy, or if you're going to prohibit any workers from sharing, ride sharing or anything like that, but something to think about if they are going to be in vehicles. So other areas in your work environment, you're going to have to describe who's going to be cleaning them, what cleaning supplies, and for this purpose, will they be utilized, how are they going to be used, and how are you going to train all of your staff on their cleaning protocols as well. So we're talking about restrooms, break rooms, lunch rooms, meeting rooms, and any high touch areas, right? Your phones, your keyboards, your touch screens, controls, door handles, elevator panels if you're in a multi-story building, the railings, copy machines. I think you kind of get the idea. We're going to be cleaning every day, frequent cleaning, those high touch areas. For those of you who need drop-off and pick-up protocols, something else to think about if you're going to be having lock boxes or keys dropped off or even paperwork, think about what those protocols are going to be when you're interacting with your consumers. Another key component of your plan has to be your communication and training. You obviously have to communicate your preparedness plan to all of the workers. You have to train all workers and and plan on ongoing training. So if you find the next component of that is you have to make sure that your management is continually trying to monitor the effectiveness of the preparedness plan implementation and modify that as necessary. So that might require some ongoing training. Again, this should cover instructions to all workers as well as your customers and clients or any visitors on what your protection protocols are. Okay, so as I talked to you about, the general business preparedness plan also requires additional protection and protocols if you are a customer-facing business. And this is where we are really kind of unique in Minnesota, or as a business in Minnesota, in that we are really kind of more of an office, but you also are going to be dealing with interfacing with customers on a regular basis, whether that's showings, open houses, meeting your clients, etc. So what they mean by that is any business that has in-person customer interactions, you're going to have to think about what provisions you're going to need to protect the consuming public. So you're going to have to address things such as what kind of protective equipment you're going to be offering, what kind of access and assignment will you be allowing to your building, and how is that going to work? Again, sanitation and hygiene protocols if you're going to be interacting with the consuming public. Their hand washing protocols for you and the guests. For us, it's going to be what happens when they're entering into the properties. You're also going to have to figure out distancing and barriers, managing the occupancy of that property, limiting face-to-face interaction, and if you're going to be receiving or exchanging any payment, whether that's your earnest money or things of that nature, you need to think about that. And again, any other protocols for your particular business activities, you're going to have to think about putting the specifics of that in your preparedness plan. So again, as part of your decision-making standard, it's important that realtors think about how we're going to care for others, and obviously try to reduce the risk of exposure for our own members and spreading to others as well. So I want you all to know that we did put out a showing and open house consideration guideline that I think will help you in developing the last part of the preparedness plan, this extra consumer-facing component. It talks about these items: health and wellness, social distancing, the cleaning and sanitation, and operations and communications. So just a reminder, obviously, you have to think about if you're going to hold an open house or when you're going to a showing, how are we going to have that consumer washing their hands? How are you going to have that consumer think about staying home when they're sick or monitoring their own symptoms? And of course, reminding them how to cover their cough. So again, what are your protocols for ill staff? Are they going to be able to meet with them in an open house? Are they going to be able to go to showings if we have any ill staff? I would strongly encourage you to consult with your clients to understand who they would be okay with entering into the property when it's listed. Another big consideration is, are they a vulnerable population? And then what steps are you going to take to minimize the spread of the virus? Are we going to prohibit them from coming into the house? So how are you going to deal with that screening? Another question that comes up frequently is what happens if I'm sick? Obviously, the Minnesota Department of Health says you need to stay at home for at least 7 days. This is just I'm sick, not necessarily that I had COVID, but you also should stay home for at least 3 days with no fever and improvement of respiratory symptoms, whichever is longer. So 7 days or 3 days with no fever. You should not be going out and doing showings or open houses or interacting with the consuming public. Again, important to have your own screenings as well. So I would have you consider adopting the Minnesota Department of Health screening checklist as a way to advise your clients, to inform you as to what their status is. So anybody who wants to go into that open house or showing might want to consider having them enter into that. They also have other tools. Department of Health put out some signs that says, to stop and help protect our residents. If you don't, please don't enter if you have these signs and symptoms. That would be a great signage for you to put on any showing or open house day at the property. You can also have your clients do a self-check. There are tools. The Minnesota Department of Health has put out a Minnesota symptom screener or a self-screen tool. If they do have some sort of symptoms, it's going to walk them through some questions and tell them whether or not they should be staying home or not. So it's, again, you might want to advise your clients to self-check on that day, self-check their temp, self-check their own symptoms to ensure that they're not spreading anything. I would make sure you encourage you strongly to make sure you're asking all prospective buyers the same questions, just to make sure there's no violation of any fair housing laws. And then also decide how you're going to handle rejections and implement them consistently. And then, of course, as always, have a plan to protect and permanently dispose of any information you're going to be collecting. I just want to, give you fair warning that the CDC is already concerned about any stigma or discrimination that might be occurring for people who have already had COVID-19, and they're doing that based upon a nationality or some particular population, even though they might not be at risk. Also, if they've been released from COVID quarantine too, there might be some stigma as well. So just be cautious on how you're implementing your health screenings. Make sure it's consistent with every person who wants to see it. All right, so if you're exposed, the other question that comes up frequently, as from a worker standpoint, or even your consumer standpoint, the Department of Health has said that if you're lab confirmed, you need to stay home for 14 days. If you're in close contact with someone who for example, if you're living with them or you have some sort of relationship with them, the Department of Health has strongly encouraged you to stay home as much as possible and monitor your health for 14 days. If you have just had contact with somebody who was exposed, so they don't have any symptoms, you can go about your normal activities, but certainly want to check with once you prepare this preparedness plan, what are your policies going to be about these circumstances for your own business and your clients as well? So some additional measures you can take, as I mentioned, you might want to post this sign, do not enter if they have symptoms. You might also want to think about no touching signs to make sure that they're cleaning their hands before and after, and providing PPE and information about COVID spread. So again, think about if they're going to be in that property, are you going to require cloth face coverings? Are you going to provide hand sanitizer at the door? You're going to provide tissues in case somebody sneezes, and of course those receptacles as well. I will point out too that the guidelines do now state that if you are a worker and you are interfacing with the consuming public, you are required to wear a face covering. That's under the current guidelines. So it seems to be changing into a mandatory thing if you are a worker working with a consuming public. Of course, on the flip side of that, will you require a consumer to wear one when they enter? I think that's important for you to have a conversation with your client, and then how are you going to refuse them if they're going to be refusing to wear a cloth face covering. As I mentioned, protect vulnerable population. The governor has indicated specifically that you have an obligation to do so. That means older adults who are 65 plus, people who are living in nursing homes or long-term care, and any other groups at high risk of severe illness, as you see here. As respiratory etiquette, again, something we've already kind of gone through on the worker side, but again, make sure workers are wearing face coverings. Should your client wear them? Are you going to provide them any protocols for anybody who's refusing to wear them? Are they going to be allowed in or not, in order to protect your client? Cover your cough and sneeze and hang those posters. Another thing you should seriously think about is limiting the amount of time that they're going to be allowed in the property, and reduce your face-to-face interactions. So if you can, stand to the side or even behind them, so you're not necessarily face-to-face. And I know another common thing that our members do is wanting to put some food out for those open houses, I think you should probably think twice about having any communal food or drinks when you're doing an open house. Just some reminders from the Department of Health. Your face covering is for protecting others, not you. You're still obligated to stay home if you're sick, and don't use them on children under 2. Social distancing, interestingly, is not just the 6 feet away. Minnesota Department of Health has defined that to be voluntarily staying at home versus going out in public. Keeping distance between you and others, of course, that's the 6 feet. Don't gather in small crowded areas. Postpone any gatherings or gather virtually if it's at all possible. And of course, the other strong recommendation is to limit the number of people to 10 or less. Again, don't forget to do your hand hygiene here, 20 seconds for real. There is a proper way to wash your hands. Otherwise, it's just going to be a waste of your time. Are you going to require them to wash their hands when they're walking into the property? And are you going to be providing stations or alcohol-based hand sanitizer? I'll just point out that if you are going to be doing sanitizer, it has to have at least 60% alcohol in it. So things to think about when you're visiting a home: does anyone present or going to be present at that property have any flu-like symptoms? Is your client in a vulnerable population? If yes, we're not going in. You're obligated to minimize the transmission, so keep that visit as short as possible. Properly wash your hands, and frequently take that hand sanitizer with you. Always remind them to cover their coughs, sneezes, and you have to do the same. Another important reminder is to try to avoid touching things, right? Ask that client or seller of yours to open the doors, turn on the lights so that nobody else has to touch anything as much as possible. Don't touch your eyes and face, particularly after you've touched some surface. So again, sort of some basic reminders that you're going to need to implement for your clients as well. Okay, the operations and communications component of your preparedness plan for your clients. If you're, again, evaluate the space and regulate visitor movement through it. If you're having an open house, how many people can go in at one time? What's the walk flow going to look like? Can you rearrange that room so that it's a one-way tour through the property and back out without having any sort of passages? Don't let people sit around in the kitchen and congregate in a small bedroom. So the point, of course, is we don't want people in a small space for a long period of time. So again, make it as contactless as possible as well. And the important point for you on that one was to make sure you're communicating that well. So you're going to have protocols on how you're going to communicate that to your clients. And the cleaning and disinfecting component for your clients is even a little trickier, right? You should really consult with your client before using any cleaning products. Some clients are very sensitive to smells and products, so something you should have a conversation with them about. And I would also suggest that the Department of Health has guidance for cleaning and disinfecting at home, and those might be obviously better guidance for you to utilize in discussing with your clients how they're going to be cleaning and disinfecting that property, particularly before and after we have open houses and showings. Another strong recommendation is prohibiting the use of any bathrooms or facilities, and understand that there might be some protocols for that homeowner if we do have this big, large open house from the standpoint of what our cleaning obligations are going to be. And that's pretty much a whirlwind tour of what you're going to have to think about in your preparedness plan. I know that seems a bit overwhelming, but like I said, we've put all of the important, most critical components of that on our preparedness plan web page. So you can link to what I have tried to pull out all of the relevant documents to help you just walk through and start creating that plan for yourself. So. Lori, that's all I have, and if anybody has any other questions, okay, I'd be happy to try to answer.
Yeah, I'm going to read off a few to you. Is that okay?
Absolutely.
Okay, so one is, can you reiterate if this is only required for real estate agents that have an LLC or S Corp, or for all agents? And does this document need to be submitted somewhere by the end of the day today?
Okay, good question. So again, what the executive order and the preparedness plan say is any business that is in operation. So presumably we mean the definition of business means I'm an organized business, right? So if you're just a sales associate, it's probably going to be relying on the broker's preparedness plan, and they're going to have to relay that to you. But if you are a sales associate, that you have your own business, right? You are in operation. There's, like I said, there's no exception to this rule at this point, right? As there's been no clarification from the Department of Commerce. But if you are a business, you have to adopt this plan. And there is no requirement for you to submit this preparedness plan anywhere. You just have to have it available and ready, and then if DEED were to ask for it, you would have to be able to provide it upon their request.
Great. Another one, should we limit it to one family member at a time per visit during the open house, and should we limit that to adults only?
Another good question. Again, I think it's important to think about the number of people, not a unit of people or type of person, right? So obviously, I know that some places have indicated that children can't go in. I would be a little bit more cautious on the real estate side of that because we do have fair housing laws, and you cannot discriminate against persons based on familial status. We just don't know what the interpretations are on that. So from my perspective, it's really more about a matter of how many people do you intend to let into that property. I would certainly suggest you think about consulting with your client and having it limited to decision makers if it's at all possible. But decision makers is different than saying I'm only allowing adults, or because if you're in a circumstance where I'm the adult and I have no other option but to bring my children with me, I think it'd be a very difficult situation to say you don't get to go see it just because you have kids and your kids aren't allowed in the property. So that's really the dilemma there. So my recommendation is to think about how you're going to manage numbers, the number of people, how much time they're in it, and again, make sure that we're talking about the decision makers who are only the critical people who are going in to look at the property.
Great. This one has come up a couple of times, so I'm just going to ask it once, obviously.
Okay.
If a home seller or a resident of a home has had COVID, but has recovered or is asymptomatic, must that be disclosed to potential home buyers?
Great question. We don't have a black and white answer on that. All I can tell you is we can only infer from what we have under current law, and that is this. A seller of a residential property has to disclose all material facts of which they're aware that could affect the buyer's use or enjoyment of the property. Now, that being said, there are exceptions to that general disclosure law, right? And one of the exceptions is you do not have to disclose if the person in that property had HIV or AIDS. And I think that is the most reflective or similar circumstance to what we're dealing with now. So from my perspective, I think that's a battle between, do I disclose somebody's health condition, or do I err on the side of disclosing a material fact? This is something you should really have a conversation with your seller client about. From my perspective, I do not think that there would be an obligation to disclose. That said, we just don't have an answer yet from the standpoint of if that were to be pushed, and whether or not a buyer would sue a seller for failure to disclose that, or a licensee. But again, from my perspective, I think the issue of a person's medical condition is going to win out on that particular argument. That's my guess. And I think it's a slippery slope to start saying that you had to disclose if you had COVID. For example, why didn't we disclose if you had the flu before? Can be just as deadly for some people. There's all other kinds of communicable diseases that we should be talking about, not just COVID. So again, from my perspective, I would say it would err on the side of keeping that medical information confidential.
Okay. My office is in an office complex, and I do not have control over the ventilation system. How should this be addressed in the plan?
Yeah, I think you should work with your building, whoever. I presume there might be some association or whoever the landlord is. I would work with them to understand what the current status is of that, and just reflect that in your preparedness plan as to what you've inquired about, what you believe the current status to be, what those maintenance plans are going to be. They're going to have to provide you some information so you can properly comply with that plan.
Okay, just two more. Any recommendations from the MDH regarding the use of vinyl gloves?
There has been no recommendations regarding use of gloves. From my perspective on that, I think you could be transferring COVID just as much as you're wearing gloves if you were wearing, just having bare hands. The important point there is just don't touch your face, right? But I suppose it's possible for you to think about whether you're going to require them or not, because if somebody did sneeze into their hands and then they started touching surfaces, again, the protocols on that, you're going to have to learn the protocols, right, as far as whether that's going to be helpful for you or not. If I start with a dirty hand and put it in the glove and I take it off and touch everything, it doesn't matter. Or if I sneeze into my glove and I touch my face or touch other things, it's not going to matter. So they do not at this point have any recommendations regarding gloves.
Okay, and then I think the last one, although I may agree with the EO in full, are these considered recommendations and guidelines rather than the law? And the only thing required is to have a PP.
Well, there are minimum requirements, as I talked about at the very beginning. So Executive Order 74 does indicate that you are required to have those minimum items in your preparedness plan. There is no requirement to utilize the DEED's template preparedness plan in doing that, but you're going to have some minimums in that preparedness plan that meet the obligations under the executive's order, as well as the Minnesota Department of Health guidelines, the CDC guidelines, and OSHA guidelines. That you've been obligated to operate under those guidelines already as a critical sector business. So reflecting that in your preparedness plan would not be a bad idea. So like I said, there's no specific plan that you have to have, but you're going to have some of the basics in there.
All right. I think that is it, Susan. I'm going to answer a bunch of the same questions at once. I will email out everybody on the webinar when materials from the webinar are posted, which I hope I can get done real quick. So that should answer a whole bunch of those questions.
Sounds good. All right. Well, thank you very much for attending today.
Thank you, Susan.
Bye-bye.